But I was more concerned to go in depth with the rural people who were politically and economically downplayed by the authorities. I'm very much delighted to partake in this event. I, Sri Francis Amara, former Vice President of Garo Students Union, Karakol Regional Unit, and now currently working as the General Secretary of Constitutional Rights Forum, headquartered Tura, Meghalaya. Residing in a democratic country, the Constitution of India has given us a right to make a decision by ourselves in any situation. We have been given the power by the Constitution of India to act freely and accordingly. Well, during the pandemic, many has lost their near and dear ones, lost jobs, and has faced unspeakable dire consequences. Well, in Garo Hills, Meghalaya, the people, the community has been psychologically affected because of the health workers that works round the clock. Not because they have done a tremendous work, but because of the behavioral trends by the health authorities towards the people. The kind of health situation in Garo Hills has been downplayed post-COVID by the authorities. Pre-COVID, everything goes accordingly, blocking to and fro from the rural pockets of Garo Hills to different hospitals, and there was no issue at all. To my surprise, once the COVID began erupting like a lava, the kind of attention by the people has changed dramatically. You know, the politicians, they do whatever they like, during campaigns, during the election, as if nothing happens. But when the election, when everything goes over, the kind of ignorance from the medical doctors, religious leaders, officers as well, changes, differentiating and dividing the people between vaccinated and unvaccinated. To be honest, I myself still haven't received a COVID vaccine, but don't get scared. Because still right now I'm safe and sound. The kind of mental harassment by the authorities at some point crosses the limit where at the point people from Garo Hills began to break the rules because the district administration, because the politicians, they themselves doesn't follow the COVID protocols and SOPs. Still, we are in touch with one case where one student who is in 5th semester pursuing Bachelor of Arts, and I don't want to name his name, he was suspended for 6 months by the principal. Not because he has done something mischievous, but he refused to receive the jab when the class has just resumed after the COVID outbreak. Ab initio, we thought everything will be alright, but the COVID outbreak, it has changes a lot. Number one, psychological effects. Number two, kind of racism, kind of division among people between vaccinated and unvaccinated. Number three, acceptability and reliability, because you see many of you from Meghalaya, you can see even the government has ordered, those who were vaccinated, they are the only one who will be allowed to attend the churches. It breaks, it manipulates the fundamental rights which has been given by the Constitution of India. You see, the sad reality is that the more we try to preach that COVID vaccine is not safe from the coronavirus, the more pressure or consequences we have to face. You see, from the Constitutional Rights Forum, we had filed an RTI from each and every district of Garo Hills. There are 5 districts in Garo Hills, and then we filed an RTI regarding COVID, and we asked them to furnish the authenticity whether the COVID vaccine is safe or not. But when the result came out, that COVID vaccine is just an immunization process. And like, they have said, yeah, still we have that RTI, like, if any one of you who wants to read that RTI, like, we can provide it as well. Then it is still not safe, but the government, but the, they use different strategies to manipulate the whole data or the whole people or the whole section of the community to divert the mind, to divert the thinking, to divert, their works. Most of the time we do receive a complaint from different people. From the employees, government employees, from different people, from students community, they were forced to take a action. Like if they didn't take a action, like obviously either their salary will be deducted or they will be terminated from the service.
Every 10 days testing.
Moreover, it's a sad reality. If you do not, suppose you're an employee of any organization, or whether even if you're a student, if you're not vaccinated, you're supposed to have, to show the COVID testing, which has been done, in different hospitals. Moreover, in one incident, I still remember that we were invited by the district administration, but I don't want to name that district. Okay. Then there they told, a COVID vaccine is still safe, and then but okay. Therefore, I'd like to request each and every one of you from different organizations, from different states, let us come together, let us join hands together. Even if the medical officers, they do know that COVID vaccine is still, it's not safe.
They had, the heart got hardened, the cells got hardened. So the risk of stroke after getting vaccine was much higher. This is the reality. And children in vaccine, like we all said, it is all business. But really, research in children, COVID for children, wherever it has been done globally. Sorry, thank you. I'm very old. Wherever it had been done globally, wherever research had been done, it has been proved that among the seropositive patients, seropositive, I think you understand, right? Positive COVID patients, which are below 15 years of age. They take out the serum, that is what I mean to say, and they test rapid antibody test. Is it alright? So among those seropositive patients, children have a higher antibody persistence than adults. So why the fear? Children will take it as it comes. Whichever genotype it is. Like for example now Omicron. Oh my God, Omicron. There is no oh my God. I will just keep you into thinking like this, not scientific at all. Okay? Not scientific at all. But just imagine, Kappa was virus of interest, VOI. It was declared. Then came Delta, VOC. Then when VOC came, Kappa was removed from VOI. So every issue was about Delta. And then came AY strain. I think you've heard about it. AY strain, the very, very fast strain which, no? Oh, okay. Oh yeah, some have heard. So it is, AY strain is more transmissible than the Delta strain. I will just say that. But the severity is much, much lesser. So people were hoping that, 1 minute, yes. Okay, people were hoping that the Omicron